Although it may seem surprising, some types of cancer can be detected through changes in certain body odors. Science has made great progress in this area, and there are already studies showing that some tumors produce specific chemical compounds, which can be expelled by the body and detected through breath, sweat, or feces. Today, we're sharing 5 types of odors that could indicate the silent presence of cancer in the body. Recognizing these signs can be crucial for early detection, which could mean the difference between a successful recovery and a late diagnosis. Before we begin, let us know in the comments how old you are and which city you're watching from. Your participation is important and helps us create more useful content for you. Don't forget to like and subscribe for more health and wellness tips that could make a big difference in your life and the lives of your loved ones. Let's get started. Number 1. Intestinal cancer. Intestinal cancer, also known as colorectal cancer, is one of the most common types worldwide. However, it's also one of the hardest to detect in its early stages because it often develops silently, without obvious symptoms. Still, our body can send subtle signals, such as changes in body odor, that should not be ignored. The intestine is a complex and essential organ, home to trillions of bacteria that play a key role in digestion and overall health. This internal ecosystem, known as the gut microbiota, is highly sensitive to disruption. When a tumor begins to develop in this area, it can upset this balance, causing abnormal fermentation and the release of unusual chemical compounds with distinct odors. Some odor changes that may signal a problem include stronger, more acidic-smelling stool. Bowel movements may take on a very strong, foul odor, even with no major changes in diet. This happens because the tumor can interfere with digestion and alter the composition of waste. Metallic smell. Hidden blood in the stool is a classic sign of colorectal cancer. Even when it's not visible, it can give off a metallic scent, similar to iron, which is not typical. Unusual intestinal gas. Gas may become more frequent, persistent, and particularly unpleasant due to toxin buildup or partial blockages caused by the tumor. Strange-smelling breath. In more advanced stages, chemical compounds produced in the intestine may be absorbed into the bloodstream and exhaled. This can cause breath to smell like chemicals, rotting food, or even sulfur. These signs are often confused with common digestive issues like irritable bowel syndrome, food intolerances, or indigestion. However, when these odors are persistent and occur alongside other symptoms such as changes in bowel habits, chronic constipation or diarrhea, unexplained weight loss, constant fatigue, abdominal pain, or the feeling that the bowel doesn't fully empty, it's essential to seek medical attention. Early diagnosis can make a huge difference in the effectiveness of treatment. Number 2. Liver cancer. The liver plays vital roles, filtering toxins from the blood, aiding in fat digestion, metabolizing medications and nutrients, and producing essential proteins. When a tumor affects this organ, many of these functions are impaired, which can lead to a buildup of harmful substances that manifest in the body, including through changes in odor. Common odor-related signs of liver cancer include breath smelling like ammonia. This is one of the most frequently reported signs. When the body cannot eliminate nitrogen properly, it converts it into ammonia, which can be detected in the breath or sweat. Some people describe this smell as similar to urine or cleaning products. Sweat that smells like rotten fruit or acid. In some cases, patients may give off a sweet but unpleasant acidic odor due to toxin accumulation. Jaundice and odor changes. Jaundice, yellowing of the skin and eyes, is a sign of serious liver damage. In these cases, body odor may intensify due to elevated bilirubin levels in the blood. These odors may persist despite good hygiene. If they are accompanied by other symptoms such as pain or bloating in the upper right side of the abdomen, weight loss, extreme fatigue, frequent nausea or vomiting, it's critical to see a specialist. Early detection of liver cancer significantly improves the chances of successful treatment. Number 3. Lung cancer. Although lung cancer primarily affects the respiratory system, it can also produce unusual odors when breathing or speaking. This is because lung tumors can release volatile chemical compounds that are exhaled, changing the natural smell of breath. Breath changes that may serve as warning signs include acidic or chemical odor. Some people describe their breath as having a strong, chemical-like smell, similar to solvents or cleaning agents. This is due to volatile organic compounds released by the tumor. Smell of rotting meat or putrefaction. This may be related to tissue necrosis, death of cancerous tissue, or secondary infections, which are common in advanced stages of lung cancer. Presence of hydrogen sulfide. This gas, which smells like rotten eggs, can be released when lung tissue is severely damaged. In addition to bad breath, the person may experience persistent cough, sometimes with blood, chest pain, long-lasting hoarseness, shortness of breath or wheezing. It's important to note that these symptoms can occur even in non-smokers, especially those exposed to environmental pollutants, secondhand smoke, or toxic chemicals at work. If these signs persist, they should not be ignored. Prompt medical evaluation is essential and may include diagnostic tests such as X-rays, CT scans, or sputum analysis to detect lung cancer in its early stages. Number 4. Leukemia. Leukemia is a type of cancer that affects blood-forming tissues, mainly the bone marrow and white blood cells. As it develops, it interferes with the normal production of blood cells and impacts the immune system and metabolism. This internal dysfunction can be reflected through various symptoms, including unusual changes in body or breath odor. How can leukemia influence body odor? When the bone marrow produces cancerous cells instead of healthy ones, metabolic waste accumulates, waste that the body can no longer eliminate efficiently. This buildup of toxins and byproducts can lead to abnormal odors, especially noticeable in the breath and sweat. Common odor-related signs include sweet, metallic, or chemical-smelling breath. Some people describe the odor as similar to acetone or industrial chemicals. This may result from metabolic imbalances caused by an excess of immature cells in the blood. Increased uric acid levels. When cancerous cells break down rapidly, especially during initial treatments or in aggressive leukemias, uric acid levels rise significantly. The buildup of this substance in the blood and tissues can cause a strong, acidic, and unpleasant odor in sweat or breath. Metallic or iron-like odor. Leukemia often causes anemia, which can lead to bleeding from the gums, nose, or even the gastrointestinal tract. These bleeds may give breath or sweat a metallic smell due to the iron content in the blood. Presence of ketones in the breath. Similar to people with uncontrolled diabetes, a body that cannot metabolize nutrients properly may produce ketones. These substances have a strong, sweet scent and are exhaled through the breath. Additional symptoms that may accompany these odor changes include persistent or recurrent fever with no clear cause, extreme fatigue that doesn't improve with rest, frequent bruising or unexplained bleeding, constant infections or slow-healing wounds, bone or joint pain. These signs may develop gradually or appear suddenly. If you notice persistent and unusual odors accompanied by any of these symptoms, seek medical attention promptly. A simple blood test could be the first step toward detecting leukemia in time. Number 5. Oral or throat cancer. While it's normal for breath to have some odor, especially after eating or upon waking, persistent, unpleasant breath may signal something more serious, such as oral or throat cancer. This type of cancer can affect various areas of the mouth, including the tongue, gums, palate, inner cheeks, tonsils, pharynx, or larynx. In its early stages, it may go unnoticed, but as it progresses, the affected tissue begins to show clear signs, one of the most common being chronic bad breath. Causes of foul odor related to oral or throat cancer. Tissue necrosis, death as the tumor grows, it can destroy surrounding healthy tissue. This breakdown produces a putrid smell, very similar to rotting meat, which persists even with good oral hygiene. Secondary infections. Ulcers or wounds caused by the tumor are often exposed to bacteria in the mouth, making them prone to infection. These infections worsen bad breath, producing foul-smelling gases such as sulfur compounds. Frequent bleeding. Blood in the saliva from internal wounds or inflammation can give the breath a metallic or iron-like smell, sometimes described as rusty. Bacterial overgrowth. The altered environment caused by cancer favors the growth of anaerobic bacteria, which produce malodorous compounds like methylmercaptan or dimethyl sulfide, both of which are hard to eliminate with brushing or rinsing. Other symptoms to watch for along with persistent bad breath. Pain or burning when swallowing. Sensation of something stuck in the throat. Voice changes, hoarseness or a deeper tone. Mouth ulcers that do not heal. Difficulty speaking or chewing. Swelling or a lump in the neck or jaw. If these symptoms last more than 2 weeks, or if the bad breath doesn't improve despite constant hygiene, it's vital to consult a dentist or an ENT specialist. Early detection can greatly improve the prognosis and treatment options. Conclusion. These 5 types of cancer can cause subtle but significant changes in body odor. Paying attention to these signs, especially when accompanied by other symptoms, can help detect the disease before it progresses. If you notice anything unusual in yourself or someone close to you, consult a healthcare professional. Early detection can save lives. And that's it for today's video. If you found this content useful, share it with your friends and family. Someone close to you might also benefit from improving their mobility, energy, or overall quality of life. And of course, don't forget to like this video and subscribe to the channel so you can keep receiving valuable health information that could transform your everyday life. See you in the next video.